Welcome back to TV5 News at 9. Joining us this morning is neurosurgeon Dr. Jay Jaganathan. Thank you so much for taking the time to speak with us.
Thanks for having me, Veronica.
So today we are talking about lumbar disc herniations. What is that?
So lumbar disc herniation is a disc that's bulging or herniated into the spinal canal. When it does herniate into the canal like that, sometimes it can cause pressure on the nerves and some symptoms from that.
And what are some of the symptoms that patients might have?
The most common symptom that I see as a neurosurgeon with patients coming to my office is often pain. The pain is described as radicular pain, which means that it's pain that is on the distribution of a nerve root. So typically it starts in the back with radiation down the leg. Oftentimes it's the back of the leg, which is the sciatic nerve, which is a common nerve that's affected by lumbar disc herniation. Other symptoms are things like numbness and tingling. In severe cases, it can cause weakness, inability to move the foot, and in extremely severe cases, it can even cause problems with incontinence, bowel and bladder incontinence.
Oh, I'm glad that we're speaking about this because I'm sure there are many people out there who are saying, I've experienced something like this before, maybe I should get it checked out. So what are the treatments for lumbar disc herniations?
So the first step is making the diagnosis, and the standard for that is usually an MRI scan, which is pretty commonly available. Something you can get through your local primary care physician or subspecialist as needed. Typically, the first treatment for non-emergent cases, meaning cases where it's not compromising motor strength or urinary symptoms and things like that, are what are called conservative treatment, which means non-surgical treatments, and that consists of things like rest, analgesics, meaning pain control, physical therapy, oftentimes epidural steroid injections where some steroid medication is injected around the nerves can be effective for controlling pain. And finally, when those fail, we often look at surgical treatments as a final option.
And what is the recovery process like for this?
So it really depends on the type of surgery. For the most common disc herniations, meaning a single level disc that's pushing on a single nerve, it can often be done with about a 45-minute operation that's about a 2 to 3 centimeter incision. Usually it's about half the patients go home the same day, about half spend the night in the hospital. There would be some temporary restrictions with respect to lifting and bending, but surgery can be very effective, especially in cases for leg pain when the pain correlates to the location of the disc. Although we recommend surgery generally as a final option, I think in patients that have pain which is not getting better in spite of non-surgical treatments, it can be a very effective route of achieving pain control.
This is some great information, and thank you so much for taking the time to speak with us. Where can people find more?
They're welcome to visit our website, mi-neurosurgery.com, or contact our office in Bay City, which is at 989-701-2538.
And along with that, you can also get more information in the hot link section of WNEM.com.